Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, called Omicron a game changer.
Because it spreads so quickly, we're anticipating a potential impact on our healthcare system.
But the province's play has largely stayed the same. Besides more protections at long-term care homes, the Ontario government did not announce any new measures. So far, no accelerated third doses, no further restrictions, despite days of warnings from healthcare workers.
This freight train is barreling at us very quickly.
Our systems are already stressed during Christmas, and we do not need an additional stress like this to add on top of that.
Moore was asked why Ontario isn't acting faster.
I do believe there will be a discussion in the coming days about what additional measures we may need, if any.
So with this spreading so rapidly, a lot of people, I think, will be hoping that you come out with that soon.
Respirologist Samir Gupta is one of them.
We are very worried about this being inundated with people with COVID who are sick, who are, backfilling up our ICUs and our hospitals.
The province is asking Ontarians to reduce their contacts while allowing them to attend full-capacity stadium events. A confusing message, says Gupta.
It's like at earlier phases of this pandemic where the government is not taking the steps it needs to take.
Moore was the top doctor in the Kingston region throughout most of the pandemic when the area was a COVID success story. But he does not have the final call on Ontario's COVID policy.
At the end of the day, it's government that makes these decisions. It's not the Chief Medical Officer of Health.
Moore hinted at further announcements, and one is expected from Premier Doug Ford on Wednesday about the province's rollout of third doses. The Premier is set to meet with his cabinet in the morning. Ellen Morrow, CBC News, Toronto.
Now, infectious diseases specialist Dr. Susie Hoda is here to fill in some of the blanks for us. So, Dr. Hoda, an expected announcement on third doses, but tell me, what more would you have liked to see being done? What needs to be done here?
Well, I think there are a couple of things that really need to be done right now. First of all, we absolutely need to accelerate the third dose rollout across the country. In Ontario, where right now we're really seeing Omicron take off, we need to get third doses into everybody who could be over the age of 18, because this can affect all of us. And taking the previous approach of sort of a stratified age related approach no longer is valid. We're not talking just about waning immunity. We're talking about 2 doses not providing enough protection, and that third dose really increasing the protection for Omicron. So that's one big thing.
Right. Yeah, go ahead.
I think the other thing, though, is that's not going to hit us or help us quickly enough. So we really do need to put in some restrictions in terms of, public health measures. That's capacity restrictions, limiting the number of social contacts that people will have to get us through what is likely to happen in the next few weeks.
And what about what we just heard about from Rosie? I mean, at a federal level, what appears to be this emphasis on travel advisories, potentially travel bans, stricter quarantine and testing measures. Do those kinds of things go the distance?
Testing definitely can help because it allows us to have an early detection system for cases and isolate people promptly. In terms of travel-related restrictions at this stage, we're seeing community transmission in many parts of Ontario, where I can see what's happening really very clearly. And I think that that's going to have limited utility. The path has already been set. We're going to see the cases rise from here based on community transmission.
Okay, Dr. Hoda, thank you so much.